Does beetroot lower blood pressure? Consuming beetroot daily can keep the blood pressure under check, says research. Drinking a glass of fresh beetroot juice daily can significantly reduce the blood pressure in individuals with hypertension. Having high blood pressure increases the risk of heart diseases, stroke, and kidney disease. Hence, it is important to control high blood pressure by making a certain diet and lifestyle changes. Adding beetroot to your diet is a safe, natural, and cost-effective way to bring high blood pressure under control. Let's have a look at how this amazing vegetable helps in lowering high blood pressure. How does beetroot lower blood pressure? Studies have found that beetroot juice favors blood pressure parameter control in hypertensive patients through a high synthesis of nitric oxide. Vegetables like beetroot contain high levels of nitrate, which get converted to nitric oxide in the body. Nitric oxide is a vasodilator, meaning it relaxes the inner muscles of the blood vessels. It further widens the arteries and the blood vessels, which increases the blood flow and lowers blood pressure. It allows smooth blood flow all through the body, and reduces pressure on the inner walls of the arteries. One interesting study found that intake of beetroot juice for 4 weeks improved diastolic and systolic blood pressure. Hence, daily consumption of beetroot along with sodium restriction is a great strategy for blood pressure control. How can you add beetroot to your diet? You can simply enjoy this vegetable in the raw uncooked form, which is the best form. You can combine this ruby red delight with other veggies to make your own healthy salad. As shown in the research, having beetroot juice is the best and easiest way to lower high blood pressure. You can also blend beetroot and other vegetables together to make a nutritious soup. Some eat boiled beetroot, but nutrition content reduces in boiled vegetables.